One of the most important things that we offer is an understanding of culture and also language. So if a parent, a concerned parent calls me, they can freely speak in Arabic with me and just tell me what they're seeing. And I tell them, you don't need to use medical words, you don't need to use metaphors, you don't need to use your sometimes not great English. Just speak and tell me what's happening. And they just start telling me their daughter or son's story and their concerns around that. And then part of our support is also telling them how they can approach their loved one and how we can approach them in the early stages. My name is Shahira Kamal. I'm Clinical Director of Harbour. Cultural sensitivity is an essential part of defining mental health and mental illness. How depression is defined in the West is different from how it is defined or understood in Arab communities. And so the treatment plan and what recovery looks like is also very differently defined. Within the Arab community, the biggest difference that we encounter is the family, the role of the family and community. So that's one layer. Another layer is also acceptance and shame and stigma. So an example that I always use, if someone comes out as gay in London, we'd plan with them how they would tell their family and loved ones. Somewhere in the Arab world, Egypt, Saudi or Dubai, that's a very different conversation. In a lot of these countries it's illegal, seen as religiously immoral. So in addition to the shame that comes with the depression, there is an extra bit of shame of, oh, I'm not even religious enough, I'm not moral enough, I'm not doing my duty towards God, or I'm doing it and God is not accepting me. That adds another complication again. And then part of our role is how to come to terms with that and marry these different understandings of depression, homosexuality, addictions. Our pre-assessment process is quite lengthy. It's much more extensive than other treatment centers. It includes a very comprehensive psychiatric assessment, but also includes a pre-assessment interview with myself, questionnaires that they have to fill in around their own beliefs, what's important to them, the cultural values. So part of that we're gathering the information of what matters to the client. Then we use that as part of their treatment plan. Another component also that we often add is around spirituality. We generally have a practitioner that is dedicated to opening that up with a client a few times a week, talking about their spiritual and religious beliefs and how that becomes a strength rather than a pressure that shames them. Harbour tailors its approach to Arabic-speaking clients by firstly involving the family, because we know that's a big component of a client's life, with a big discussion with the client about what needs to be kept out of family meetings and what doesn't. We are very aware that there are cultural family gatherings that are very important for Arabic families, so weddings, engagements, but these are also high-pressure environments for someone, say, in early addiction treatment or recovery, so we support them through that. We choose residential properties that you can't tell from that. They are just basic residential properties. It's not a hospital. We choose them in very quiet residential streets. We have a multidisciplinary team at Harbour who are all very culturally aware. Some are Arabic speaking and some aren't, which is actually an important combination because especially with the younger generation, they don't want an all Arab practitioner team. They wouldn't trust that. What distinguishes us from anyone else is this individualized, personalized approach. So we take an Arab family, we take an Arab client, and we fully immerse ourselves in their world. What is important to them? Is it religion? Is it spirituality? Is it work? Is it the family reputation? And then we create a holistic treatment plan around that. I think in group settings you can't get that. You can't get that individualized approach to each client. I think a lot of Arab clients really respond well to the combination of us being in London but also being culturally sensitive and understanding their language.